The diaphragm, a lot of times, will have what's called hiatal hernias. Hiatal hernia is what? The stomach gets tense for whatever reason, and it wants to tighten up. It's a muscle. Anytime it tightens up, the muscle has to go toward its origin. Well, it has a strap that attaches back on the anterior longitudinal ligament area back against the spine. That's the only firm attachment, and so it has to go up through the diaphragm. Well, the diaphragm already has a hole in it where the vena cava and the aorta have to come through the hole, and so does the esophagus. Well, that's all the bigger that hole's supposed to be, and then there's supposed to be a fat pad to live on this side over here. Well, what happens is the stomach gets tight or emotional. We get emotional stuff happening, and it starts to tighten like any other muscle and move up toward its origin, and when it does, it starts to pull a little bitty hole through that diaphragm and make the hole in the diaphragm larger. And then you got a little mini stomach above, and you got a regular stomach below. You got to be able to pull that down. This is one of the very best techniques, manual therapy techniques, for pulling that diaphragm, that mini stomach, down back through the diaphragm and allowing that to heal, so the lower esophageal sphincter, which is getting the cancer because that gastric and hydrochloric acids now got pressure and is pushing that valve and putting the acid onto the esophagus. It's precancer, and so you want to get rid of this before it starts into that Barrett syndrome precancer. Here's how to do it.